This is Smile Business Diaries, a DSD podcast.
Welcome, Dr. Fadi Yassmin. How are you today?
I'm very good. Very good. Thank you for having me. I'm in lovely Dubai at the moment, which is always fun.
Yes, the rock star life, right?
No. Just the transit life.
Well, it's wonderful having you. You're such a great representation of what it means to incorporate like a luxury dental office and business. So I feel that the listeners will gain a lot of insight as to, who you are and how you've become who you are today. Would you share just a little bit of information on, what it's like for you every day and what your practice is like?
Sure. Like you said, I mean, I run a boutique aesthetic practice. I don't like to use the word cosmetic as much. It's more aesthetic and multidisciplinary. So the evolution of our practice has been from the fact that I've always been about comprehensive treatment. And when I say comprehensive, in the sense, we like to look at all disciplines that apply to each case. So when someone comes in, and I'm sure we'll delve on this later, it's more about, I wanted to have a practice where I could treat every patient ideally and not just by the limitation of what my skill base was. So for me, the more I practiced, the more I realized I had to, educate and be able to sort of master quite a few disciplines, especially to be able to bring it all together in aesthetic dentistry. So that's pretty much the niche practice I run. It's a multidisciplinary aesthetic center. And the luxury part, I guess, had to come naturally because I wanted something to complement my treatment because I've always been obsessed with perfection, giving perfect treatment, even, from attempting from day one of graduating. So I guess the practice was just a natural progression, but it was all underpinned by my sort of practice, the type of dentistry I do.
And when you say it came naturally or formed over the years, there had to have been some kind of influence for you. Can you list anyone or anything that impacted you the most in that process?
Oh, 100%. And he actually passed away last month. So it was literally my mentor I was referred to a practice day one by one of my tutors. And he said, you should really, you should try working here if you can. And so he referred me to this practice. And it was a general practitioner who had limited his practice to orthodontics only, but general dentistry and multidisciplinary. So it was from really day one there that I learned about efficiency in practice. When I say efficiency of actual movements, the way you sit, posture. He was quite big on that. And I think that's something that's so missed out in dentistry. We've got all these fancy chairs and fancy gadgets. He had a system that he had been using for many years to keep posture and limited movements during practice. So that was one important thing. And from there, just the way that we approach treatments. And that was really my first foray into multidisciplinary treatment. He was big on orthodontics initially for any cases, then followed up by any aesthetic things at the time. So back then it was bonding and some crowns and so forth. So really that was me. I was very, very lucky to have that from day one. So I was programmed into ideal patient comfort and ideal treatment from day one. There was no compromise. Mind you, it was the lowest paying assistant dental job in the country, but it was worth every cent,
Absolutely. Yeah, I always believe that we learn the most when we have the least, right? And it's like
Exactly.
lessons you can't replicate, And so, are there any other lessons that you could think of besides that? Because you've built such a beautiful practice, and your team. We're going to get into that as well. How you've been able to select such great minds and wonderful people around you. Um, but is there anything else that you can say? Okay, this was a monumental, pivotal moment for me to get you to where you are today.
I think, like you said, a pinnacle or instrumental is having the ability or the so-called ability to select the right people for your position. But it's also they have to, you have to be on the same sort of mindset. You have to get along. I know people like to keep certain things, professionally and business and, you know, not cross over into almost like a friendship. I've never believed that because everyone that's ever worked for me is pretty much a friend. We're a family. So family that works professionally. That's and the interesting thing is patients see that. They actually tell us, they go, this is an unusual dental office. You guys are like, I feel like family. They treat it like that. It's because I think it's underpinned by the fact that they love what they do. They're working with an ethical dentist. They're seeing this every day. How often do you hear staff talk about, their principals saying, God, I'd never get that done here. Or, every single treatment is something that I would do for myself. Everything that comes through our door has to pass the daughter test, which is an actual paper. So it has to pass the daughter test. If it's not suitable for you or your family, then it's not going to be suitable for my patients. And that's actually very easy to do. If you stick to those guns, you can do dentistry for a long time. If you try and manipulate that or, horses for courses, then you're going to get into a bit of trouble and you'll be found out and unstuck.
Absolutely. Can you explain that more? What is the door to test?
The daughter test was actually a paper. I sort of came across this paper when I was doing my master's at King's College. So a dentist actually wrote a paper. When you diagnose, and because cosmetic dentistry is quite huge, young patients are coming in asking for veneers, and the daughter test, was the question to dentists, would you do this for your daughter? And they actually wrote a paper on it and they called it the daughter test. So I always keep it in the back of my mind. I don't have any daughters, so it's probably the son test for me, and it's always about the right treatment. Now, dental treatments can be argued and debated among dentists, but if you feel in your own heart that's the right treatment and that's what you can justify, then that's what you're going to be doing.
Yeah. And I mean, you're obviously a DSD clinic and you've got this surrounding around you. Do you feel that because you're the first point of contact, right, with the patient, but you have DSD incorporate their plannings around your treatment. So how has that affected your door to test scenarios? Does that complement? Have you ever found that maybe, there's been a different plan ahead that you didn't recognize initially? Any scenario?
Yeah, of course. I mean, the classic thing with all of our DSD and planning is the immediate highlight where a lot of these cases, if we're going to aesthetic finalizing, is they'll very likely benefit from orthodontics. And straight away, when you do your mock-up, the first thing you see is that's quite, you're trying to perform quite a lot by placing some pros on there. And immediately, two things, you can show the patient how beautiful it's going to look, if that's what we're looking at, but also you can show them, how thick and how much I have to cut back to get it there. But I can show you this next phase where I'll get the same external appearance, but look how thin it is. Look how minimal I have to sort of cut away your teeth, which means, whatever we do now, and I always give them a 10, 15-year window, it has to be redone. So we've got to think about throwing them in the deep end at an early stage. What are the options? What can we do? So all of those things, yeah, the powerful tools of DSD from a planning perspective, but also future planning perspective. And you're able to show that to patients very, very specifically. And they get it. You'd be surprised how they understand it. And they say, oh yeah, look how overlapped my teeth are, but it looks great from the front. I said, yeah, for me to achieve that, I have to cut a lot of teeth unnecessarily.
Hello, I'm just taking a quick break from this podcast interview to tell you how you can get started with DSD. If there was anything that our guest has mentioned that strikes a chord with you, or you are curious about becoming a DSD clinic, I encourage you to book a call with me. This is a 30-minute, no-obligation information sharing session in which I can answer your questions about DSD and discuss your options based on your unique circumstances. The link to schedule a call with me can be found in the notes on this episode. Now, back to the interview.
So for me, that's always been huge. I mean, we get beautiful illustrations. We can show all of those things. You've got a 3D model showing the exterior final destination where you're existing, and it doesn't take an engineer or a scientist to work out, wow, if I'm here and I need to be here, if I'm here, I need to be here. you know, I need to move things around. It just makes sense. So yeah, definitely the DSD side of things has certainly just made it seamless, to be honest.
And I would guess too, you do a lot of veneers and a lot of aesthetics. I'm not even gonna say
Yeah.
cosmetics now since you said that. Um, but has there ever been a moment or a patient in particular that you can think of that has challenged you when you've said, "Hey, this isn't my way of doing things. I'm not going to cut your teeth and, take off half of your tooth structure because you want it."
Yeah.
What have you done?
All the time, all the time. Like, this is the daughter test part, right? You just gotta stand true to your word, and I'm pretty stubborn with that stuff. Like, and I've lost a few cases over the years. I mean, they go down the road and get them done. But, when someone comes in insisting and their teeth are fine and they're like 28 years old and they've got great teeth, they just need a bit of alignment. What are you gonna do? Cut these teeth? You just can't do it. I just can't do it. I mean, I'll show them what the issues are, try and talk them out of it. And you can always have a really good chance if they're willing to entertain the idea of, say, some sort of straightening or a sort of alignment, because you get to the end of the alignment and they go, "Oh, you're right. They actually look really good. I like them. I'm not bothered by this too." And really, sometimes the things that bother them aren't as big as they perceive. And, some people think they have to cut their whole front teeth just because the lateral's sticking out. But you push it in the right position, all of a sudden, oh my God, that looks great. Or you might polish some edges at the end, which I do a lot of, and balance the symmetry or in asymmetry. Um, and then all of a sudden it's like, "Oh, no, no, I don't want veneers." I said, "Well, exactly. That was our whole point, Often you do your best with this first step, and if you don't like it, then we can make that discussion." So if you can sort of push them to have the orthodontics or some minor stuff in the meantime, just to get them over the line, because often they're still not seeing what you can do, even though it's quite simple. So they're still stuck on the fact they either no treatment or massive treatment. So if you can get them to the in that in between, that's when you often get them over the line. But there's patients that no matter what you say, there's some sort of body dysmorphia issues that, they want to get their plastics, their veneers, their cosmetic surgery. It's a whole thing for them. It's a whole journey. So, and I'll see someone else and you see them, on social media not too long after with ugly white BL1 opaque tea, you know?
Well, at the same time, I think it's such a hard thing to let someone go, right, in any situation. But in this specific situation, I think it's important to stay true to that, because let's say you do the work for the patient, they're insistent, and then you start to get more of those patients. So it's almost like a filtration system for the people that you want to see, right? Because you convince the person that wanted veneers in the beginning, that person stuck out to me. You said, "Okay, now look, you don't need veneers," and they figure this out on their own. And then imagine the trust that comes between you and that patient at that point. You know that they're gonna rave about you to everybody else, and so you get more of those patients. And so I think you've got such a great system, and a lot of this too, I know, comes from your team as well. It's not all just you running the whole practice. I wanted to ask you, because you have such a great way of doing things, where we can control ourselves, but we can't control others, and you have an exceptional team. How do you replicate this into your team?
The replica, I mean, there's good management that I've got, that we've been working together for, over 16 years. So, whatever I'm about to say, Nicola would know about it before it comes out of my mouth. And that's sort of a top-down effect. It just trickles. I think if you have consistency in your everyday practice, mannerisms, um, personality, people know what you are. Your patients know what you are. Your team members know what you are. So they know what's expected, and it's predictable in their mind. Like, they know when Fadi goes in there and sees that, "Oh, he's not gonna do veneers for her." They know that. And then I walk in and I say, "No, you're not suitable." Because they come in and do a lot of the pre-diagnosis, because they've spoken to the patient, 80% of the time they're spot on, because they've seen how I work, they've seen our ethical side in terms of how we diagnosed. And it's like my patient, my nurse comes in, she says, "Oh, that's so and so, but I don't think she needs this. I think she needs this. She should do it." It's like spot on because they're just hearing everything I say every day. Everything's consistent. It's much easier to be consistent than inconsistent. And that's how you develop that sense of um, trust, that sense of team, because imagine everyone being on the same page. My aim is for everyone to be on the same page. Now, there might be others that are not as skilled. Some do things a little bit more, but we're all on the same page. There might be different levels of ability, but we're all on the same level field, which is what you want. You don't want a staff member or someone that's doesn't agree with your treatment philosophy. That for me is the biggest thing. And I've had a few of those. Not everyone's been a slam dunk. I've had a few, not that they didn't agree, I think they were carrying such baggage from their previous practices that they just came in with this bad attitude. But over time they came round if they had the ability, or if they had, if I tolerated them long enough to be able to get them up to speed. But often if they come from a practice that, you hear all this negative stuff and they're expecting the same, because that's what all dentists are, they're so and so. So that's it. It's about getting them to understand the consistency and how much, I actually believe in everything I do. And once they have that, the rest is easy.
Absolutely. Now, we can't have this podcast without mentioning Nicola. She's a huge Nicola. Who is that? She's such a core ingredient to your practice, and I think there's a story behind that. How 16 years together now, right? How did that relation start and build over the progression of the business, and how does it work together?
Look, I mean, the decision to hire a practice manager at the time was a big decision because we were transitioning into a period that was very different. I had gotten involved with a corporate, right at like what you call a DSO. There was many things going on, and it was a huge change. I've just renovated my first little baby practice, and then I needed someone to try and drive it. And it was a very sort of not rough seas, but it was very different to what was going on. And it was down to two candidates. And thank God I picked Nicola. It worked out. That worked out amazing. But for me, I like to put a lot of trust and push um, my staff. But in her case, you know, there was always that room to grow. Um, a lot of trial and error. Whatever we needed to do, whatever she suggested, we would go with. It was never a fight. It was always just progression. It was like we'd do something, we'll try something else, and continue, because everything we were doing was uncharted. All the things we were doing, there was no like, oh yeah, let's do what they've done. Nobody was doing this stuff, like from just the way aesthetics was being portrayed. Building a practice with a certain facility, targeting certain areas, like just starting to do education. It was all of a sudden, once we got involved with the DSD, we had an amazing education sort of platform that we were doing. But all of this was new to us. But if you've got the right people like Nicole, whatever I would throw in for whatever challenge, I said, "Here, you need to learn how to do this," and she'd come back and give her all the stuff. She'd come back and just knows it inside out. You know how much you can sort of push and expect out of your staff.
Yeah, for sure. She seems to be kind of like the coordinator for everyone in the office, and it's very clear. She has a good way of training her skills into others. I know she's not here, but would you be able to elaborate on, how does Nicola do this on your behalf, and how has it worked out, for you?
It's great because I just say, "Nicola, can you do this?" And she'll go do it. That's pretty much it. She doesn't even ask anymore. She just asks out of curiosity, "Oh, do you mind if I hire so and so? Because I think, oh yeah, you know." She said, "Yeah, well, how do you feel about me placing an ad to get it someone for so so?" I'll go, "Yeah." I think she's just entertaining me, feeling like I got to make a decision. It's like she'd already done it, right? The person's hired. So, oh shit, I forgot to ask him. Yeah, I'm interviewing 4 or 5 people for this new role. yeah, sure, I think that's a great idea. And tomorrow someone walks in, go, oh, have we finished it already? Geez, yeah, it was like, you cheeky little thing. But yeah, I mean, it's just trust in their ability and just knowing. I mean, mind you, she hasn't always been 100%, neither have I. But you don't let that, you don't get caught up on that. And she's very thick-skinned, which is amazing. It's like, we can not agree on something that day and you think, God, it's all over. And the next day, like nothing happened. Um, and that's something she's taught me because I'm one of those people that will drag on stuff for weeks, where she's like, next day, get over it, mate. Let's move on. Let's do this. Take it on the chin, which is incredible. So I guess that's just luck for me. I was lucky to find someone like that. If I want to go and say, oh, I chose her because I've got a very specific, test that I do during my interviews and, it's a psych test I've developed and no, I think I was lucky. I certainly lucked out in that one.
Well, I mean, I would think, because it's very hard for anyone to trust these days, right? And I kind of want to rewind back to the point of when you were hiring Nicola and then immediately gave her the open avenue to be creative and think of out of the box situations for your practice, for your baby at the moment, right? How did you do that? Because I think it's an overall challenge for anyone to say, I'm gonna give you my baby and I'm gonna trust you to take care of it.
Yeah, look, one thing that I was very impressed and mesmerized by was how mature she was for such a young age. I mean, Nicole applied for a huge role in our practice, and it was a huge role that was moving forward, even though it was quite a long time ago. I think she would have been 25 at the time, which I think is quite young for what I was expecting. So, when I realized just how advanced, definitely fits the expression wise beyond her years. For me, it was very easy to hand over stuff and be confident enough that I think she has the capacity to be able to get a result. And from then on, anything that I saw, I would basically point and shoot. I'd say, yep, there, and basically whichever way, any sort of processes and things that we would want to sort of put together, it was very easy for me to point and shoot, basically.
And I know that there was a moment going from your original practice together, you built the new practice that you're in today. There's a lot that goes into building, right? And ups and downs. So would you be able to share your story in that and what it was like?
Yeah, look, I guess it was one of those. We were very lucky we were lucky because of such a horrible, unlucky event. So what I mean by that is we signed the lease for the new practice the day before it was declared a worldwide pandemic. So you can imagine, I thought, what the F have I done here? I've just signed up to build a brand new practice with a brand new premises, committed to these astronomical lease because we're in such a beautiful area. And then this thing, COVID, came along. And I didn't even know what the hell we're going to do. We're not meant to work. We're meant to work. Am I going to be able to get the materials? Like, we didn't really think supply was going to be an issue. What we were thinking, we had all these restrictions on working. So are they going to be able to come turn up and work and so forth? Look, unfortunately, it was probably the best thing that could have happened because for a while we couldn't work. So that allowed me to be on site, which I reckon I would have never done because I would have been at work and I would have missed so much. And it all would have dragged things out. But the beautiful thing, the first 4 months, I couldn't do much anyway. So I was on site every day, which we're allowed because building and construction, as you know, was the only thing that wasn't restricted. It was an essential service. So we were very, very lucky in that sense. Like I said, it was people think, the year we opened, what a horrible period. For me, it was actually a really nice period because I was building this beautiful practice. I was going to on site every day and seeing it unravel and dealing with situations. Nicole was there, we were there, the architect was there, and it was like, wow, everything was on pause, and I was able to smash this out in 6 months, which I reckon it would have taken way longer, and there would have been way more issues. So that was our fortunate situation in an unfortunate period of time in history. So that allowed us to really achieve something special, I think.
Absolutely. I mean, it sounds like a blessing in disguise, that you had the time to invest at that point. It was almost like forced on you. You can't do
Yeah,
anything.
it was crazy. Yeah, couldn't do it any other way.
Then, not many people have that luxury. So if there were someone that's listening now in the process of building their practice and they don't have the time that you had during the pandemic, what would be the top items that you'd say, think about this?
100%. Firstly, you need to get a project manager or have a real or someone within the design group that can be your project manager and liaise, say, with the builder, not liaise with your builder, because they're always like anything I've learned. There has to be a level, there has to be a sort of a wall between yourself and the final construction, because so many things can occur and without you knowing, and especially if there's no one checking. So I guess the layers would be yourself, your own management, that's like someone like Nicole, then liaising with the project manager on the design side. You just have to. You just have to do that, because otherwise, cutting those corners, the first person to do that is through the construction side. Because when things are built slightly out, you come to get your equipment, it's not fitting, you know, and cabling, and especially with digital, especially having everything in position, all the safety, electrical stuff now, that's I'm sure all over the world. So you really need to be all on top of that, and I guess push your suppliers, all your dental suppliers now. They've sort of got services that integrate for the equipment, what's expected. But again, that needs manpower, that needs a lot of stuff. And if you've got all that, that can be simplified for checklists for yourself. So that, at the end of the day, yep, this is what you need to sign off to do the project. You can go through things quickly. You can say yes, no, deal with things that are delayed. What are your options? But yeah, it's not easy. It's not easy.
The liaison almost acted like a guard between the producers and yourself. And so was it almost like they would handle all the major discussions and then just give you the summary points? Is that
No, we were right in the thick of it between myself and Nicola because we had the luxury of the time. We were in the thick of it. We're literally there, You'd see, certain dimensions, specs, and we think, why is that? Why is that half a meter out? Why is my office half the size of Nicola's? I don't remember that being in the plan, but that's another good story, actually, Marie. That's like, yeah, I don't know what happened there. So, yeah.
wow, I had no idea that you guys signed right before the pandemic, from the outside looking, in, it was like,
One day, one day before, literally 29th. I think the pandemic was March 1 and we signed like 28th of February. It's crazy. Everything had shut down.
wow. So what was your immediate what was the immediate thoughts at that moment? Was there a moment where you had to come out of a different mindset to be able to work on the office better?
Yeah, look, we just didn't understand what the restrictions were. I mean, it ended up being amazing for us. It was the busiest time of my life in dentistry because we had no restrictions to operate. Initially it was essential services, then it became you pretty much could operate as long as you followed certain protocols. Everybody was pre-rinsing, testing, and so forth. We were able to do certain surgeries under GA if we had to. Um, we were super, super busy, whereas our colleagues, the cosmetic guys, most practitioners, all the cosmetic injectors weren't. We do Botox and stuff for clinical use. So we were covering a lot of that, and yeah, for us, like I said, as long as we had our protocols, people were tested, all of those things, which is all a bit of a hoo-ha now in hindsight.
Yeah, we use your office as an example for others all the time. It's gorgeous. It's beautiful.
It is beautiful. I have to admit, it is beautiful. I mean, I spend a lot of time there, and sometimes I look at it and I think, I always wanted something. It's not for the sake of being, someone walks in and say, God, it's beautiful. For me, it's there's a certain calming sense about its architecture, its design. If I'm going to sit in a room for hours on end, I'm prepping away and I'm looking away, I want to just be calmed. I want to be calmed by my environment while I'm working, and it is a calming environment, but it happens to be beautiful. It's, it's me over the years of things that I find relaxing, serene, what I like. It's a combination of Japanese, Zen, functional, clinical, sterile, all in one. So yeah, and it works. It really works. It's just one of those things that that flows, and you can do a ton of dentistry in there and not feel like, it's like being on a very, very comfortable plane, that's fully decked out, and you can keep flying on that plane as long as you want because it's so beautiful. You don't realize that you've been cruising for 17 hours, because it just doesn't feel it.
Exactly. You spend most of your life in the office, right? If you think about it,
100%.
or wake life. And so you want it to be comfortable. You want to have it be somewhere that you want to go every day and not feel like, oh gosh, I have to go there again, right? And so that's an amazing point you made. On the other end of it, how do you feel your patients react to the office just by itself and the feelings that they get from it?
Yeah, there's two sort of reactions. There's the, "Oh my god, this is just the most beautiful practice," and the other one is, "Oh my god, this is gonna be expensive." You know? So, and sometimes it's both, but they're all positive, they're all like, there's some, there's been a few new patients that I guess with the place, the location makes it easier. Like if I had that office, say, in another area, so I had it in my previous area, which is still, still a nice city area, it would have been a bit harder to swallow. You would have probably had, "Oh, this is a bit over the top," sorta, whereas it's expected where I am. It's like, our Beverly Hills, so to speak. So for us there, we don't get so many of those reactions, but we do get, people love the serenity of it all. It's not unusual. And for me, I did want it to be like, and there's a lot of beautiful hairdressing salons around us that I think probably spend twice as much on the fit out. So I didn't want to be another hairdressing salon in the sense of what I wanted was to be a beautiful, serene practice. But when they stepped into the operatory, they knew that it was clinically impeccable. So it wasn't, one of those beautifully designed dysfunctional or unfunctional areas. Whereas as soon as they got out of their serene zone, they're in, where I practice, and that's full on. That's very clinical, but has an element of calming to it. So, but yeah, we do get a lot of beautiful react. They're just mesmerized by it. Like, this is unusual, and it's, what impresses everyone is how clean it is, how clean it looks. They said, "This is the cleanest practice I've ever seen." Like, everything's so clean. And I'm a minimalist, so I always, let my staff know, and they know I hate stuff on bench tops. Minimal. I don't even have, boxes and gloves, nothing. No, I try and minimize anything. When we need it, we put it on. It's all in the drawers. It's accessible. So that also looks nice. I don't have clutter everywhere. I have everything ready for each procedure. Um, for me, I guess that helps. And that's, tied in with that Japanese philosophy that I was trained on for, 30 years ago of minimal movement, minimal ergonomics. I think, I don't know if you know my practice, there's this, the dentist cradling the patient in a horizontal position. That came from the treatment philosophy that I was trained in. So basically, the patient is flat, the dentist is in upright position, and there's only two positions that you would use to basically work, and that's how that ergonomic flow, and that basically embodies what we try and put.
So you work like intersecting almost to your patient. Is that how?
Yeah, I mean, if you look, I don't know if you've got a picture of the front of our practice. Basically, it's, yeah, you're working sitting at 12 o'clock, looking down on a patient that's flat. There's only two positions that you rotate around the head, and you can do everything in dentistry from that position. Yeah, and the assistant is parallel. Yeah, it's a Japanese philosophy that was put together by an American dentist that went over to Japan and worked for Merita. So Merita, which is the biggest dental company in Japan. And they basically supply every dental chair in Japan, but they did a lot of work outside, especially in the 70s and 80s. And they had this ergonomic spaceline series that was based on where the assistant sits, the shape of the triplex, triplex and the suction had to be soft and moldable in the mouth. Minimal movements. There was nothing over the patient. Everything was under tray delivery, so the patient didn't feel confined and they could get up and move anytime. There was always a set distance from the dentist to the operator. That's why you're working at a certain distance. Like, it was amazing. I was taught all of that when I first graduated, but unfortunately, that's sort of not something that's really being pushed by Merida because they have such a huge market in Japan. They just can't be bothered with the rest of the world. But my mentor was one of the pioneers in that area and brought it to Australia and all over the world. So there's some old dentists out there that know about it, but the efficiency of that system for me stuck. So I've tried to continue bringing it, always training new assistants, new nurses, dental assistants, how to suction, how to sort of carefully rinse. This is stuff that's not trained. When you rinse someone's mouth, you just don't get your triplex and press the water button. It should be a fine mist, suction on either side of the mouth, not down the throat. Just all these little techniques that can make the experience, that adds to the experience. Because when someone comes in and you can do stuff very efficiently and very quickly, patients appreciate it. And I always tell my patients, the quicker I can do something, more expensive it's going to be. They laugh. They go, "Oh, but you only took 1 minute, or you took 10 minutes to do something." I said, "Yeah, because it takes a lot of planning and skill and design to be able to deliver something so efficiently, so quickly." People think, "Oh, he has to work on me for an hour and a half to justify what I just paid." I'm the total opposite. I'm the total opposite. I want to be able to do something so efficiently at the highest level. And they get that, and we laugh about it now with patients.
Yeah, when the patients complain that it was too quick.
It was that was too quick. Like, you charge me for something. I said, "Yeah, I don't charge per hour. I charge on delivery."
Wanna stay, they wanna relax. Yeah. I think it's amazing that, it's known, right, in dental businesses that you need to enhance the experience for your patients, but the thing that stood out for me that when you were talking is that you're practicing what you preach and you're doing it in real time right in front of the patient. Do you ever find yourself telling these stories to the patient so they understand, your methodology and your philosophies from the core of how you sit and how
Yeah.
use it and everything like that?
They love it. They absolutely all the time, all the time. Like, just them, because they come in from another practice. Like, they come into practice, they'll have something, they'll get up, spit and rinse, go back, do something. I have no spitting and rinsing in my practice. There's no need to. I mean, my practice has a spittoon, but we usually don't use it just to rinse our etch when we're bonding, because you don't need to. You need to lie down, relax. If you need to be rinsed, we have these beautiful rinsing tools and suction that can, stop you. This is the ergonomic side of things. Imagine doing something and someone has to get up and spit and rinse 5 times as opposed to someone that doesn't. There's already 10 minutes. 10 minutes of spitting, and also besides the infection control factor, you can't sterilize an aerosol, no matter what you do. You can wipe the chair down, but you've got everyone that want to do the big whirlpool in their mouth and it will spit out and all that. It's like, dude, what are you doing? Just rinse it out. I do a pre-rinse, rinse out while we're working, continue, very efficient, no stop starting. I keep them in the same position. Um, very, very controlled way how you go in the mouth. I always tell my assistants when I'm training them, they do this. They just sort of jump in. I said, it's got to be slow in, slow out, slow in, slow out. And that's why when someone comes in, they go, "Oh, you're amazing. You guys are so gentle. I didn't feel a thing." But they don't realize it's 20 things that have to be done to achieve that. And that's how I've been doing it for so long. So it's not just really about me. It's more the process. And they don't realize what's going on. They don't realize they're just lying on this beautiful bed. They haven't moved at all. They haven't had to get up and rinse. They just came, they lied down, they opened, and they were done. Thank you very much. For them, it's like compared to their previous appointment. So they don't know that was the issue or that was the difference. They just think, "Oh, he's not rough. oh, I didn't get this, I didn't get that. But they don't realize all these things that you got to do. And that makes it easier.
I try to teach the DSD coordinators in our course on treatment plan presentation, and one of the things I mention is just to try to communicate in the best way possible is that when you present the treatment plan or when you do anything in dentistry or in life and you want to portray a certain image or way of the experience, I compare it to being like a wine connoisseur, like you
Yeah.
are presenting this bottle of wine and you're telling the story and it's like just the movements and the gracefulness, and I think you've captured that a lot. Is there anything else, you guys are truly like the masters of the patient experience, if I can say that. So I know you've got some secrets in your sleeve, and I understand if you don't want to share, but is there anything that you would share for others that, just this thing here or there would make a phenomenal difference for their practice?
You can't rush these things. Like, for me, I love the mock up. It's about the mock up and I never rush it. It's always meticulous. There's always, spending a lot of time to get that right. Even every second I drive them crazy when we do our presentation, the angle of the photo. Going, Colin, why did we use this one? That's crazy. Then, just being on point, being aware. Every single one is like your first one. And if you do that, and even if you're doing that and the patient's waiting next to you, they go, like, this is my guy, if this guy's fussing over with his staff about the photo, can you imagine what he's going to do about my teeth? So, and it's not a show, it's not a put on, like short of being, it's like, come on, girls, you need to get that right. Short of being that, you're like, oh my God, he's so obsessed about the presentation and getting it right. So I'm totally safe. I know he's going to do the right thing. And they need to, and all of them say, they go, you know what, we're going ahead with you because I trust you. I go, but you just met me. They go, no, you love what you do. I can see you love what you do. I can see I'm going to get the right treatment. And that's, again, like whatever you do, if you do it with your heart, people will see it. People will see it. And that's what you got to do. You just got to stick to your guns. If you don't feel it's the right treatment, don't do it. You might lose one. You'll lose one, you'll gain 5. It is what it is.
Absolutely. That's great advice. Now we're coming to the end of our time.
Oh, I was having so much fun.
Is there anything you want to share that I haven't touched on?
Um,
Feel-
yeah, I think there was a really good question. I like the question of, what are the 3, I mean, there was some things, you talk about what are the key moments in your whole career. I guess one of the key thing is I found is obviously the day I graduated. Because, that's so tough. I had no idea. I didn't know anything. I thought I did, and just where I came from a family that hadn't, it was mostly working class. It wasn't, there was no academia. So for us, it was a great achievement but I didn't have that fallback. I had a lot of classmates that dads were dentists, that dads were doctors. They understood the process. I felt I was quite, I wasn't the only one, but there was a few that just had to do it on their own. And for me, that was such a moment of relief. It was like, the yeah, probably one of the greatest feelings. And then a week later, realizing, oh my God, I know nothing. And then that journey of building it up, but again, having a mentor that and having a mentor, it really is important to get yourself a mentor and not just go to anyone that is a good dentist. You have to, that's something that I guess you've got to work out yourself. So you gotta find someone that you think is if someone you aspire to, research them, ask about them, and if you can get in there and work for nothing, do it because you'll make it up tenfold. Like I said, I worked for 2, 3 years for virtually nothing, and my colleagues were making a lot of money and had great lifestyles, and I was still driving the same Honda Civic that I had when I was in the 3rd and 4th year. And I thought, "Oh, you know what? No, this will pay off. This will pay off," because I was already, mastered orthodontics. I was already doing ortho year out. I was doing all this stuff. I already had an understanding. I understood ergonomics in seating. I was so proud of myself, but I was making no money. But it all makes sense for it later.
Right. And just the knowing of it, you not everyone has that drive, and so that's very clear from the beginning, from what you're saying. And I mean, I can say you've made it now. You
Yeah,
yeah.
well, yeah, I guess the simple term would be align yourself with the best of each discipline in each field, because you'll start to see overlap. Because the best of the best, when I say the best, I'm not saying the best on social media, the best. I'm talking, you know, uh, someone that you see and you start to develop a skill of ruling out, fads, charlatans, hype. You see the guys that just consistently work, and they are working with the same level of consistency in other disciplines. And now I'm in that group, so to speak. So you got to find them, and now it's easy because a lot of them post stuff. You can see stuff online. You don't even have to be connected with them. You can connect through the education platforms, but you need to identify those early, and that's what you got to sort of push yourself. But definitely the way to go.
So that was 2 milestones you said, right? The graduation.
Yeah. So I have to admit, getting my master's in aesthetic
Wow.
dentistry was a huge one for me, because I hadn't done any study, because I was studying in the analog days. I'll tell you a good story. This is funny. In the analog days, where everything was, get the lectures, get them printed, read them, study them, put everything online. So the rude awakening for me was when I did my master's. It had sort of gone to digital, and we moved into the digital era where you had to be annotating everything, and everything was slightly different. And my first shock was when I handed in my master's, one of my first dissertations assignments. And I was very proud of myself. I wrote this beautiful 8,000 word essay on aesthetic dentistry and perceptions and so forth. And they had this program called Turnitin. Have you heard about it?
No.
Yeah. So it's a plagiarizing software, right? So it's a so they give you, I think the university gives you 2 goes at it, just to make sure you're
Oh, no.
yeah, I know, I know. Anyway, I thought it was really good. Yeah, put all these things together. So I ran it the first time through, and it came back at 87% plagiarized. That's when I realized, yeah.
Yeah.
But, anyway, it was all sorted in the end. But like, that was the rude awakening for me. Say, hey, the easy good old days, they're non-existent. I think I got to step it up with these young fellas now. So that was pretty funny. That was a rude awakening for me. I thought, this is easy. Yeah, just cut and paste. I'm all over it. And like 87%, I thought, geez, I better work hard for this one. That was yeah, I better reshuffle that a bit.
Yeah, exactly. Oh my goodness. I mean, I think it's so important to have, some humbling checkpoints throughout, right? And
Yeah, that was humbling, all right.
very clear you do that from time to time. As far as you come, I mean, your branding, your imagery of the practice itself is so strong. It really is. So I think it's refreshing for people to know, like, even with all the glam and all the aesthetics, right? There's still gonna be challenges. There's still gonna be moments where you have to check yourself and say, how can I do better and how can I do more, right? Because you could have 87% out there doing the same
Can
thing.
you imagine? Yeah, you always got to be. You always got to be, because there's always someone wanting to be better, take you down. Find an excuse. For me, it's like being at that level. There's always someone looking to sort of justify, or sort of say, this, they're not what they seem to be. And I've always been obsessed with maintaining that. Because people, in Australia, we have a thing called tall poppy syndrome, where people really love to find reasons to knock you down. So you got to stay on top of it. And I guess that's around the world in anything. As soon as you start to rise above, or you're gaining some sort of notoriety, people want to find an excuse to justify, you know, something that you're not, or why.
And just being strong in your why and your passion.
Stick to your guns, stick to your morals, ethics, code of practice, and I think you'll be okay.
Thank you so much for sharing that. I'm gonna ask you one more question. We are doing something where we have somebody previously on a different podcast ask the
Mhm.
questions of the guests. So the question for you is, what could we really do as clinics to get the full digital workflow and access no workaround? So what do you feel, maybe incorporating the future with AI possibly, but how can we implement a complete start to finish digital workflow with no workarounds involved?
Very easy, because that's where I am now. I just spent a week fine-tuning certain workflows in full arch implants. It's very simple. Firstly, you have to have the equipment, and it's not a big deal. That's available, your scanners and software. You have to have an understanding of your scanners, how they work. You have to be able to print. Secondly, understand all those materials, how they work. That's the easy non-negotiables. Next, you have to understand the communication softwares of each of those things. Say printing, you have to understand how to print and what are the changes, and you have to understand the adaptability for each material. So that's step one. Secondly, you have to have a completely digital lab. You have to have a completely digital lab. And that within that digital lab, they have to have a CAD and CAM department that understands designs and that you can send designs over. There's a process where you confirm the design before it goes to a mill or a print. And then you have to understand how that lab sends their designs to the next process of production. Is it a true milling? Is it a monolithic scenario? Is there touching and tampering by adding layering, if that's what you're getting? So this is on the prosthetic side, say, veneers and crowns. But your lab has to be all of that. With full arch implant stuff, that's a little bit more complicated because then you have to have specific labs for that. Definitely from what I'm seeing, a lot of those workflows have to be digital because planning is imperative now and guided is imperative. I do a lot of free-handed stuff with my full arch. I'm probably pushing now, and you speak to a lot of the top guys around the world that were masters freehand. Now they say guided is the way to go. So again, for you to be guided, you have to be completely digital. You have to have the right CBCT, the right software. That software has to talk to your planning software, has to be integrated into your Smile design, all on the one platform with all the clinicians that are taking part are able to jump on and see everything. It's a little bit complicated with Planning Center. So often we move all the Planning Center files into a Dropbox that's shared so everybody can see what's going on. But there's, things evolving now where everything can be changed in real time. All the clinicians collaborating can see it. That's important. But definitely, you have to have the right technicians for the right disciplines, understanding of all the softwares, knowing what softwares they use, and so forth. Yeah, it's definitely doable. We're totally like that now. Totally.
Yeah, start to finish. That's amazing. Thank you so much for sharing
Thank
your
you. My pleasure.